Everyone right to go? Thanks for joining us. 90.5% of Victorians have now had a first dose, and 71.1% of Victorians aged over 16 are fully protected by one of the COVID-19 vaccines. That's why today we can end the lockdown. That's why today we can begin really meaningful steps to open up our city and state, to have our freedoms back. Today is a day to say thank you to more than 5.1 million Victorians who've had at least one dose, and that more than 70% of Victorians who've had both. Now, we do have to finish this job off, and that is, of course, making sure that we turn up for our appointments for those critical second doses, and that if you're on the fence, if you haven't quite made up your mind yet, please go and get a first and a second dose. These vaccines work. They will keep you safe, they will keep you out of hospital, and they will allow us to continue to open up. They are, in every way, our ticket out of this, and indeed beyond. So Victorians, it's fair to say, have done a quite amazing thing. So many people going and getting vaccinated so quickly. We always said that lockdowns were a function of not having the vaccine that we needed, but that if we got vaccinated, we'd have so many more options, so many more ways that we could get back to normal. I simply cannot tell you how proud I am of every single Victorian who has persevered, shown great courage and character, but also shown amazing kindness towards each other. And that's why we're able to end the lockdown and, as I said, take really important steps towards our freedom, and a time when there aren't any rules, or so few, that we are essentially back to normal. Now, I'll run through a few of the numbers of the day, and then Brett's going to make a few comments as well, and then, of course, as usual, we're happy to take any questions that you have. I would just say at the outset, last night was a significant milestone to be past that 70% double dose and to be past 90% single dose. We believe that next weekend, so not tomorrow, but the weekend after, we believe that we will reach the 80% double dose mark, and we will deliver faithfully each and every item that's contained within Victoria's roadmap to deliver the national plan. And if we can go further, then of course we will make announcements to that effect. Now, I know everyone wants to know what's happening next weekend, and they'd like to know today. Today's not the day to make those announcements, but quite soon, just as we did last weekend, we clarified for people what would happen this week. We will be out quite soon to clarify what we hope can happen at the end of next week. And the key point here is, if you've got a second dose appointment booked and you can bring it forward, if you're past that 3-week mark for Pfizer, if you're past the 4-week mark for Moderna, then please come forward. There are appointments available. There are walk-ups where you can simply walk up and get the dose that you need. There's never been more supply. It's never been easier to complete your vaccination journey, or indeed to start it. And I'll just go back to that key point. For your safety, for the safety of your loved ones, for getting us open and keeping us open, for taking pressure off our nurses and the rest of the team in our hospitals, for all those reasons and many, many more, this is the right thing to do. It's so important that people who are on the fence go and get the first dose. We're going to get over 90%. We can be one of the most vaccinated communities anywhere in the world, and that will be such a competitive advantage for us as we push into next year. But in a very practical sense, it'll keep you out of hospital. No one wants to be a COVID patient, whether it be in ICU or just on a general ward. It's not a good thing to get if you have not been protected by one of these world-leading vaccines. So let me just go through some of the numbers. As I said, 90.5% 16 plus have one dose, 71.1% have both doses. Some 38,339 vaccines were administered in state clinics yesterday, and we've got pop-ups and micro pop-ups and the other 55 right across the city and state. Can I just give a shout out to all of the team who've been working in those hubs for months now. They've done an outstanding job. They can be proud, just as the more than 5 million Victorians who've gone and got at least one dose can be proud. And I just, on behalf of all Victorians, I thank those staff for the amazing work that they've done. We have currently 140,000 first and second dose bookings available in state hubs over the next 7 days. So those spots are there. If you can bring forward your dose, if you haven't made a booking yet, please go and do that. They're there available to you, plus GPs, plus community pharmacy. But that program is in full swing. But it's so important that we finish this off, that we don't sort of get to the point where we think that 70 is near enough. We've got to get to 80, and indeed if we can push beyond that and get to the 90% double dose plus, then again we have even more options. Now, in terms of that 140,000 first and second dose appointments, 51,000 of those are second dose Pfizer appointments. So please go online, get the information, whether it's a walk-up or making an appointment, but there's vaccine there for you, and there's someone committed to making sure that you can either begin or complete your vaccination journey. There are now 784 people who are currently in hospital with COVID-19. 145 of those are in intensive care, and 94 of those are on a ventilator. Of the cases in hospital yesterday, 88% were not fully vaccinated. Of the cases in intensive care yesterday, 94% of those were not fully vaccinated. There's no greater argument. If you are fully vaccinated, your chances of finishing up critically unwell, like really seriously sick with this, are a tiny fraction. If you're fully vaccinated, you're not going to finish up in hospital seriously unwell. That's what the numbers, that's what the experience, the science, the data, that's what common sense tells you as well. These vaccines are free, they're safe, and they work. And if you get the vaccine, you'll be able to do many more things, and you'll be able to take some pressure off the health system. In terms of, tragically, I have to report that some 16 Victorians have lost their lives. We pass on, of course, our deepest sympathies and condolences to the families of those people who have passed away. A man in his 60s, 4 women in their 70s, 3 men and 4 women in their 80s, and 3 women and 1 man in their 90s. This will be obviously a very difficult time for those families, and we send our best wishes and support to them. There were 77,036 test results received overnight, good strong number, and there are 2,189 new cases of coronavirus, one of which was acquired overseas. We now have some 23,230 active cases of the virus in our community. Now, just before I pass on to Brett, I've got a very important announcement to make in relation to quarantine. So from November 1, international travellers returning back to Melbourne or coming to Victoria for the first time, will not have to quarantine. They'll be able to go to home if they are double vaxxed and if they have tested before the flight and if they get a test within 24 hours of arriving home. This means that we will reduce our hotel quarantine program down to just a handful of hotels. Of course, Mickleham comes online early next year. That'll be a facility that we'll continue to use for people who aren't vaccinated or whose vaccination status is uncertain or who have a vaccine that's not approved by our federal government. This is very significant. So people will be able to, I think as the federal government have indicated, you'll be able to leave after the 1st of November. And then what I'm confirming is when you come back, if you are double vaxxed and if you've been tested before and you agree to test within 24 hours, then you will be able to go home. No hotel quarantine, no ISO, you'll be able to go about your business. And the reason for that is that at 80, 90%, which is where we're going to get to, we are as protected as we can be. Now, there'll still be some rules around masks and there'll still be some other density issues and just common sense will have to drive us. This won't be over, but we will be as protected as we can be, and that's all down to the amazing work that Victorians have done. If you are 12 and up, then you need to be double vaxxed. If you are under 12, then obviously there is no vaccine available for you. If you've got a medical condition and you can't be vaccinated, then the fully vaccinated settings apply to you, if you like. So you will be able to go, children will be able to go home with their parents. There's no hotels, there's no quarantine. Just to make that absolutely clear, there'll be a cap of some 250 who will need to hotel quarantine. So that's up to 250 people who, as I said before, either have a vaccine that's not recognised or by choice have not got vaccinated. If you are immunocompromised, for instance, you don't have to go to hotel quarantine. That's not your fault. You haven't made a choice to be ineligible for the vaccine. You will be able to go home. No ISO, no quarantine for you. So this is a freedom of movement we've not been able to enjoy for a long time. And that's all because Victorians have got vaccinated in record time and in record numbers. Not only am I grateful, not only am I proud of Victorians, but I'm able to stand here and make these announcements, and in the coming days and weeks, many, many more announcements, because Victorians have done exactly what we asked them to do. Get the jab to stay safe, get the jab to be open, and to move through this very difficult gateway to normalise this. Now, just before I ask Brett to make a few comments, I just wanted to ask everyone a couple of things today. Firstly, please let's all of us be very patient with hospice staff that are for the first time having to move and start operating within a vaccinated economy. There's bound to be a few issues with check-ins here and there. There's bound to be a few issues with queuing and all those sorts of things. But they're pleased to be open. They're pleased to be running safe venues, and we all just need to be patient and make sure that we acknowledge that they're doing some things for the very first time. The second thing that I would ask all of us just to spare a thought in everything we do, whether it's getting a second dose appointment, honouring that appointment or bringing it forward, if you're on the fence deciding to go and get your first dose and then your second dose. All the other rules, all the other common sense, please today just spare a thought, and for a few days to come yet, please just spare a thought for our nurses, our ambos, our doctors, the whole team across our health system. 700 or 800 patients doesn't seem a lot, but 700 or 800 patients who've got a widely infectious disease is a very challenging thing to have to manage. Those numbers are going to grow as we open up. And we're going to ask a lot of our nurses, and we're going to ask a lot of the team in our hospitals. Let's all of us, in the choices we make and the way that we conduct ourselves, let's all of us try our very best to not make the job of our nurses harder. Not only spare a thought for them and be grateful to them as the heroes that they are, but just let's all of us do the right thing wherever we can to make sure that we're not making their job harder than it's already going to be. It is going to be difficult in the coming weeks and months, but there's simply no choice. Victorians have done what we asked of them, and now we are delivering the roadmap, opening up safely so that we can normalise this and have our freedoms back and look with a sense of rightful optimism and hope and confidence to the rest of this year and indeed 22 beyond that. I'll now ask the Chief Health Officer to add to my comments, and then we're happy to take any and all questions you have.
Thank you, Premier. This certainly is Thank You Day. I want to thank every single Victorian who's been through so much these last 18 plus months. Again, to the healthcare workers, from primary care, community care and hospital care, who've worked so hard, who continue to work so hard to protect us all and to care for us all. And then to everyone who's really reached out to others through these really difficult months. I know that people have needed extra support, and there have been so many people who've volunteered their time and who've really had a focus on others. And really the thing that struck me through the last year and a half, maybe more than anything, and maybe in Victoria more than anywhere else, is the way that we've thought about all Victorians in the things that we've done. Of course, there's benefit for us in getting vaccinated, but there are so many conversations I've had where the focus has been on what we need to do for everyone in Victoria, what we need to do to care for everyone around us. People have done the right thing in following restrictions with that in mind and with the care and compassion for everyone in this state in mind, and that's been a really wonderful thing to watch. It has been a long time, and the lockdowns have been so difficult for so many. I think we understand why it was required. We had 20% full vaccination coverage when we went into this lockdown for the eligible population. We could not have carried on without restrictions in place, without many, many hundreds of people dying. And again, we thought about that risk and we thought about what it would mean not to follow those restrictions, and we've done a fantastic job to get to this point in time. So please, let's celebrate it. Let's enjoy this lovely day and many lovely days to come with acknowledgement that we do deserve it, that we should enjoy it, but also that there'll be people who do feel anxious, might be timid after such a long period of time. Don't feel obliged to respond to every invitation to be out and about. Do what you feel comfortable with. Recognise that it's not easy to have had such a long period of time in lockdown to then kind of emerge into the world, but enjoy the things that you do deserve, and please start to book in those things for yourself, including seeing family and friends that have been a long time coming. There is a long way to go. We need to punch through those thresholds, the 80% fully vaxxed threshold. We absolutely can and should punch through that 90% fully vaxxed threshold. We know that there are still challenges in countries that have very high vaccination rates, and we want those challenges to be as minimal as possible, and the way to do that is to have as fully vaxxed population as possible. We've got some terrific signs. The fact that there have been more than 90% now who've got their first dose amongst eligible populations from 12 years and above, means that there's every expectation that we'll have more than 90% fully vaxxed for 12 and above. That'll mean 80% or thereabouts across the total population. That should mean that we lock in some of these freedoms, some of these wonderful choices that we can have going forwards. And it's the best insurance for us and for our healthcare system. But as we start to reopen, there will be more COVID in the community really than at any other point in time. Many of those people will have mild illness because they're fully vaccinated. Many of those settings will have fully vaccinated people, but recognising that children will also be in those places and some exempt individuals will be in those places, and that getting vaccinated doesn't mean that you're absolutely guaranteed not to get the virus. You can get mild illness and you can pass it on. So we have to bear in mind those other really important protections. Checking in, wearing a mask will be really important, and on days like today, opening every door and window in sight to let that fresh air through, that'll be a really important measure. Usually at this point I'd go through the geography of cases, but that'll be in the afternoon update and available on our website. It hasn't changed largely, other than to say that the southeast of Melbourne has really seen the biggest load and the biggest surge in cases most recently. But as we move towards that 80% fully vaxxed threshold, I do want our public messaging to squarely focus on the fact that we're going to look out for our priority and at-risk populations. We don't want to leave anyone behind. We will reach into you, but please reach back out to us by taking those opportunities to get vaccinated. We don't want any priority population left behind, and we do want to punch through that next milestone and go beyond. And we will continue to communicate all of those change settings and approaches as we go forward. In terms of geography though, I want to call out a couple of things. La Trobe is experiencing high case numbers, 70 new cases today, so big challenges there, but we've had days like that in the past in regional Victoria, and they pushed through with higher and higher vaccination rates and gotten on top of those numbers with the things that we know are the public health pillars: isolation, quarantine and the contact tracing work that's being done fantastically in our local public health unit there. There is additional support for La Trobe. There's a pop-up testing team at the Traralgon Basketball Stadium. Did another 203 tests yesterday on top of all of those at the static sites. And as first dose vaccination rates in the La Trobe Valley have closed in on the state average of 91% of people 16 and above, the second dose rate is also catching up. It's at 66%. In Wodonga, we're also keeping a close eye. There is a significant outbreak in Albury, 50 cases a day in recent days. A little bit lower in Wodonga with 11 new cases, but really it's one city and there is a risk there. So we'll also keep a focus on that. We want anyone with symptoms in the Albury-Wodonga area to come forward for testing. And then on vaccination, always a good news story. For a week now, we've been administering more vaccine doses than any other jurisdiction. So we're absolutely punching through that 70% threshold and onto 80% milestone. We are determined not to leave anyone behind in that regard. So we've been doing smaller, more focal, more localised pop-ups that are really focused on those postcodes that we know are underdone. So please look out for those and come forward. In Mildura, Star Health and the VAT Show there, the Victorian Aboriginal Controlled Health Organisation, partnered to deliver 2 fixed vaccination sites with assisted transport to the sites. More than 100 doses delivered through this model yesterday. And we've got 2 mobile in-home vans delivering vaccination right to people's doorsteps over coming days. There's a mini pop at Degani's Craigieburn, did 48 doses yesterday. Again, doesn't sound like a great deal, but many of those people hadn't received their first dose of vaccine. So finding and reaching into those individuals is really important for us. There are people who still haven't gotten to the point of getting vaccinated. They're not against getting vaccinated. So we want to make those available opportunities there for each and every person. We've got a new site at Bunjil Place near Fountain Gate, did 169 doses yesterday. It'll also be open to walk-ins through November. And my final message is really that vaccination is our key. We'll be opening up more and more in weeks ahead. And as people start to move around, there will be more virus than at any other point. So we need to make sure that that population who are under-vaccinated or unvaccinated move through, get their first vaccine, get their second vaccine. We've still got 20% of those over 50 who haven't been fully vaccinated. They've had their first dose but not fully vaccinated. Please make sure that if you're due for your second vaccine, you get vaccinated. And we do know, as the Premier said, 94% of people in ICU not fully vaccinated. So get in the queue to be vaccinated. Don't get in the queue to go to hospital or to be in ICU. It is so critical to protect yourself and those around you. Thank you.
Very good. We're happy to take any questions you have.
Are you concerned, Premier, by announcements in Sydney today about Qantas as bringing forward flights, new flights to Sydney? Are you concerned that Victoria is missed out or is behind?
No, we've been on the phone to Qantas all morning, Nick, and I'm pretty sure they'll have some exciting announcements to make about Melbourne too.
Have you spoken about when Victorians can go to New South Wales? Your counterpart in New South
Yeah, I
Wales.
had a good conversation with Dominic last night about a whole range of different issues. It was important that, for instance, I think they've got a 210 cap per week on unvaccinated or vaccination status uncertain people. Ours is a little bit higher than that, 250. And we look forward to making some joint announcements about the border very, very soon.
Are we seeing a stabilisation in hospitalisation numbers to case numbers at the moment? Is that vaccination doing its work in terms, not the case numbers, but in terms of that?
I wouldn't provide a medical view, but just on the numbers. Obviously, once New South Wales got past their 55, or certainly into the high 50s double dose, they started to see hospitalisation numbers come off and case numbers come off. Things are a little bit different here, and I think there's some fatigue issues and things of that nature. But what's really pleasing, is that we're not seeing 1 in 10 cases finishing up in hospital. We're seeing something considerably less than that. So there is some stability, but of course we're about to take a big step and we already have opened the place up, which will mean, as Brett says, more cases than we've ever seen. And even if they translate at a lower level, that's going to be more people in hospital. That's why it's so important. If you don't want to finish up in a hospital bed, if you don't want to finish up very ill, because this is not good to get if you've not been vaccinated. Pretty challenging if you have for some people as well, but they don't finish up in intensive care. Those numbers tell you the story. They tell you the only story that you need to know. If you get vaccinated, you will not finish up in hospital. That's what the experience is. So those numbers will grow, and that's why we're paying additional allowances to try and have the biggest team possible. It's why we're supporting our nurses and all the health team in every way we can, because they're going to have an unprecedented workload over the coming months.
Are you expecting cases to grow in line with the modelling done by the Burnet Institute?
Yeah, so obviously their modelling is now revised and refreshed, if you like, based on not assumption so much as a number of weeks of actual data. So there's no reason to think that their revised numbers won't very closely resemble the number of cases. We're a little bit ahead of that curve at the moment, a little bit better than that curve at the moment, but again, case numbers become, particularly when you get levels of protection that we have and that we're going to get. So we've got 70 locked in, we've got 90% of people plus have had their first dose. I'm not encouraging anyone not to get their second dose, and I'm not taking that for granted. In fact, we're on the phone to people, reminding them and asking them to bring their second dose appointments forward. So we'll keep pushing. But when you get to 90+% double dose, then you're as protected as you're going to be, and there's no alternative. There's simply no alternative but for us to move through that gateway. And at that point, case numbers really don't matter anywhere near as much as they did for the longest of times, because we didn't have a vaccine. That's why lockdowns were because we didn't have a vaccine. Now we have the vaccine, and quite amazingly, Victorians have gone and got the vaccine in record numbers and really fast. We don't need lockdowns anymore. That's the very simple way, but probably the best way to look at it.
Are we too pessimistic in our projections?
Well, we're dealing with people's lives. So the notion that you'd have some kind of optimistic, let's hope that works. No, you've got to have a conservative approach. You've got to have a broad-based approach where you get lots of inputs from lots of different people. The Burnet, the Doherty, all of them will tell you in great detail that they all work as hard as they can to be as accurate as possible. but it is modelling. It's not actuals, it's what they assume is going to happen. And what we really ask them to do every time they put a model together is to assume what is the outcome of millions of Victorians making hundreds and thousands of decisions each day. So you think about the vectors here. We're talking about, like, it's a very challenging thing to absolutely accurately predict where things are going. However, the burnout stuff's been pretty well spot on. They did give us a range. I think it's a great problem to have, to be at the more optimistic end of that range. But you've got to plan for the worst and then work as hard as you possibly can to deliver something better than that. And that's what Victorians have done. To be 90 plus is an amazing outcome, an amazing outcome.
Is it likely that schools, Premier, will be open full time next week? If we get to the 80% double dose percent by next weekend, perhaps Friday?
Yeah, look,
after that, or is it the day after Cup Day that we're likely?
No, I fully appreciate that you'd all like me to answer every single question. I can't give you the answer to that. We're going to work through all of those issues. We will get, it seems, provided everyone goes and gets their second appointment, and those who can bring their second dose forward, if they go and do that, then we'll get to 80% plus sometime next weekend. That gives us options. It doesn't mean that we're not at 90, so you can't pretend you are. But just as we did 70 plus, where we added some things in, like visitors to the home, freedom of movement across metropolitan Melbourne, so on and so forth, we may have some other options. I don't want to be sort of giving people a sense that it's no rules at all. That won't be what happens. But if we can go further safely, we will. But I would just remind people, and I fully appreciate that we all spend more time looking at the roadmap than what ordinary Victorians do. But at 80, we are one state again. There's a freedom of movement. The rules are the same, and there's some very big changes for hospo and for all sorts of other sectors. I'll be in a position to confirm all of that and hopefully add to it a bit in the coming days. Well, everyone would like certainty. Yeah, sure. Everyone would love certainty, and whether you're a principal or you're a chef or you're a politician, whatever you, journalist, everyone wants certainty. Of course they do, and we'll try and provide them with as much of that as we can quite soon.
What's your message to retail staff?
Just as we did last weekend, and we're here today celebrating the fact that we've hit 70.
What's your message?
How are people coming back into offices? Obviously lockdown's over, but the city isn't at sort of full capacity. I wanted to know, how do you foresee that going in the coming months, and is there any incentives you could give to encourage people back into the office to get the city going again?
Well, firstly, I had a very good discussion, regular discussion, but it just happened to be yesterday with the Lord Mayor, and we talked about some very substantial support that our government's provided to the city. There's a very exciting agenda there. I think events, a big program of things for people to do, and particularly at very low cost or no cost, is a really important part about getting people back into the city. I think that there's different groups. There's not all one group. I think there's the kind of occasional economy, if you like, where people are here, and because they're here, they buy their lunch here, or they might have a drink after work, or whatever it might be, and other retail, other goods and services they might purchase by virtue of being at the office in the centre of Melbourne, or in a big suburban centre as well. Then there's those who are coming in on the weekend maybe for an event, or during the week a show and dinner and all those sorts of things, a bit more set piece, if you like. We have to rebuild both of those, and we'll make some announcements with rules and settings, and you're right, with incentives as well, beyond what we've already done. It's a very exciting time. There's going to be a lot of really significant announcements in coming weeks, so that when I say people can be optimistic and hopeful and confident about the weeks leading into Christmas and indeed into 22, they absolutely can be.
Look like normal life?
Very, very close to it. Very, very close to it. This won't be gone though. So I'll give you one example. When I hesitate to say yes, the reason I say that is I'll give you one example. We're going to be doing booster shots. So that's not something we've ever done before. So it's a bit uncertain what our role will be in that, but we stand ready to do as much as we can to support that work. In fact, Martin Foley and Greg Hunt have been talking the last couple of days. I've written to the PM as well about boosters in aged care and whether we can bring that forward and do that as fast as we possibly can. Because what we know is that whilst these vaccines are incredibly effective, if you wait too long to get your third shot, then their efficacy, their benefit wanes. So it won't be normal in that sense. We're still going to have to do things that we've not done before, but they're all quite good problems to have, because we, as a community, have done a quite amazing thing. We have not only met our targets as a community, but we've smashed them in terms of the number of people, so the rate, and the speed at which people have gone and got the jab is something that every Victorian should be so proud of. However, we just got to finish it off. So it's a long way of saying I hope to have as few rules as possible. I hope to be as close to normal as we can possibly get. But there are going to be some things we still have to do, like booster shots, for instance.
Are you ruling out future lockdowns?
Well, the national plan talks about targeted lockdowns in a particular community if there was a low vaccination rate. I can't see an example of that would be relevant, given how many people we've got vaccinated. The national plan speaks about that. But again, we're not having statewide lockdowns, we're not having citywide lockdowns, because people have gone and done what we asked them to do. And now we're delivering what we said we'd do. That's the government I lead. We do what we say. And we said we'd open the place up if people got vaccinated, and that's what today's all about. And then we'll go further at 80 and even further at 90. And I don't think we'll stop at 90. I think it'll finish up above 90%. And we're talking with Dom last night. They're very confident that they're going to get above 90% double dose as well. They're also very confident about some of the hospital numbers and the plateauing that they're seeing, and we hope that that's repeated here.
What's your message
Sorry, Nick and then Richard.
Initially, international flights are for Australians.
Yes.
The Prime Minister said today he was confident we could start talking about tourists coming in by the end of the year. Do you share that confidence?
Well, firstly, I try to sort of stay in my lane. It's not my job to issue visas, so don't misinterpret. I'm not telling him what to do or anything, but you've asked me a question, am I optimistic about that? Yes, I am. But what I'm keen to see is double vax people coming here. Like unvaccinated people coming here is really, really challenging, and that's why we've got a cap at 250 per week. They'll be in the main Aussies, so either Australian citizens or Australian permanent residents, who are coming back and have, by choice, have decided not to get the jab. Alex Hawke made some comments the other day, and I couldn't agree with him more, that if you're a visitor visa or if you're a business visa, the notion of getting in here without having been double vaxxed by an approved vaccine, I'll try getting into the United States at the moment, or perhaps for a long time, without being double vaxxed. You're not going to get a visa. Most of Europe's like that, I understand. It's not been my number one focus in terms of travelling overseas, but everyone's got restrictions. And we need to make sure that we safeguard what we've built. The Victorian community have built, and the Australian community have built something precious. And it's been bloody hard to get to this point. Now we just have to safeguard it, because we don't want variants coming here. We don't want more virus rather than less. We don't want more pressure on our health system. And every unvaccinated person, particularly in the next few months when we're going to have transmission everywhere, it's going to move right throughout the community. Every unvaccinated person is an extraordinary risk to our health system. And it's an avoidable admission to our health system. And it's potentially taking the ICU bed of a stroke patient or a heart attack patient or a motor vehicle accident patient. That's why it's so important, for all these reasons and so many more. Please get vaccinated. Do what 5.1 million of your fellow Victorians have already done. Go and get your first dose and then follow it up with a second dose. I want tourists back here as quickly as we can, as safely as we can. And the no quarantine for double dose with some testing, that's a really important step towards that.
What's your message to retail today who are seeing hospitality open up, other industries open up, yet they can only operate outside and their business relies on people coming inside? What's your message to them who are, I guess, missing out on this reopening?
Well, we're not at 80% yet, and I hope that those for whom rules still apply, I hope, and I'm sure that they know and understand that whilst we've done an amazing job, this weekend we're not at 80%, we're at 70%. Next weekend we'll be at 80, and then they can be open. And then beyond that, when we get to 90%, won't quite be the weekend after that, it'll take a couple of weeks, few weeks, but then there'll be even greater freedoms from there. So, you know, masks outside go next weekend, retail can open, you can move throughout the state, all sorts of other changes that are in the roadmap, and hopefully we can add a few more to that. That's what we've done all the way through. And the roadmap never had retail open at 70. So, and anyone who's out there trying to suggest to you that it did, anyway, that's not what the roadmap said.
Is there a possibility that...
But we appreciate and understand it's a tough weekend for them, but 70 this weekend, 80 next weekend, and then we can get them open.
And is that 80% possible on Friday that gives people a proper long weekend for Cup weekend to maybe get out of town?
I reckon people will have a pretty proper long weekend, whether it's Friday or Saturday. I think there's a great energy around the city and state today. I think that's only going to grow throughout the week. I do understand the very practical point you make about whether you can go Friday or Saturday. I ultimately that's in the hands of every single Victorian. If you go and get your second dose this week, if you honour your appointment, so we have no one cancelling, we have no no-shows, they're pretty small numbers anyway, but we're into a business of very small numbers now. Every one matters. And if we have people who can bring their second dose forward, if they make the call, if they get online and do that, then we are a chance. But the best advice I've got is the 30th or the 31st, so we shall wait and see. But let's see how this unfolds during the week. And as you know, we moved at 11:59 p.m. last night. We hadn't quite, well, when we made the announcement, it was possible that we were still in the high 69 point something. So we'll look to be, as I said before, we'll look to have as few rules as possible, to be as open as possible, and to be giving people everything that they've earned, which is freedom.
On the hotel quarantine changes, none at all from November 1, but between now and then are we looking to match them up with the 7 days? We're hearing that some that are in quarantine right now may only have to do 7 to 8 days and
Yeah,
have
sure.
to be released.
Not quite none at all. Obviously, if you're vaccinated, none at all. And if you've got a negative test when you get on the plane and you test again, so that's within 72 hours, and then you test negative again within 24 hours of getting home. So the 250 a week, yeah, that's at 14 days. That could change though. That could change. There's all sorts of different work going on at the moment around close contact definitions, periods of ISO, who has to ISO, all that sort of stuff. So as we get more and more cases, as we get more and more people with the jab, then our risk tolerance grows. But we'll have more to say about some of those things in the future. And sorry, I should have mentioned, just those who are in hotel quarantine just before the 1st of November, regardless of how many days they've done, once the 1st of November comes, they'll be tested and they can leave hotel quarantine and go home. Obviously, if they've been double vaxxed, they'll be treated no different. We don't want people who are in for one reason when others can go straight home. So we're going to try and align that in that 24 hours before the 1st.
There are some significant major events coming up over summer and into next year with the Grand Prix and the tennis. There's been a bit of talk in recent days about other states or, potentially them not being part of Melbourne's future events calendar. What confidence do you have, given not just the rules here around crowd sizes and vaccinations, but our border rules nationally that are going to prevent some tennis players from coming, that we will be able to hold on to these major events? Yeah,
look, I don't want to personalise this down to one player, but we had a very important player in tennis didn't come here last year, or sorry, the last time we played it, and the tournament seemed to run fine. We're going to be one of the most vaccinated places anywhere in the world. That makes us one of the safest places anywhere in the world, and I think that becomes a competitive advantage to host events with confidence, to visit with absolute confidence. So, look, I think that having got through this, having prioritised health, having got the jab in such amazing numbers and in such quick time, we have so many more advantages over so many others. As for other states and events, our major events calendar is very full. It's going to get even more full, and it won't just be with capital M major events. I think lots of events in the suburbs, in regional communities, local neighbourhood events, all sorts of small stuff is going to be even more important now as people look to, stock up on all those things they've missed out on. Spending time with the people that they love.
Are you concerned that Sydney appears as though it's going to make a bid for the Grand Prix from 2025?
Oh, last time I looked, it was going to be run across the Sydney Harbour Bridge, and that was like 2 days before we signed a 10-year deal. So we don't take anything for granted, but the Grand Prix is here to stay. And anyway, that's fine. Others can have a go, but the race is here. It's going to be held in April. I look forward to sitting down with Stefano Domenicali and having a long chat about just how great it is to have Formula One back.
Are you at all worried that Sydney could pinch the F1 of us?
No, we're very confident that this is the major events capital of our nation. We're not complacent in any way though. But from time to time we get told from Sydney what they're going to pinch from us, and it very rarely happens. I can't think of an example actually, really. But anyway, that's fine.
Given that
they can talk about them, we'll actually run them.
Given that it's the Australian Grand Prix, do you think that the race...
Major events, that is.
Given that it's the Australian Grand Prix, do you think that the race should be showcased at more locations across the country rather than just in Melbourne?
No.
And
nope. Just like the grand final should be here. And we've got a contract, and I think we're going to be quite confident that next year we're going to be able to have the grand final here because it'll be safe to do that, and we'll be able to have a very, very, very big crowd. There's a long list of things that they've got the brand Australia, but they're held in Melbourne and across Victoria. That probably tells you something about where the real capital of our nation is. Create, the National Gallery. Where's that? That's right here. We are the creative capital, the cultural capital, the major events and sporting capital, and we are the get vaccinated fast capital. And I'm so proud of every Victorian who's done that.
How quickly, just on F1, how quickly do you need to finalise the deal, the extension deal for the F1 to ensure that we don't lose it?
No, I think you're being very negative about this, Julia. You're being incredibly negative. We've got a contract.
Here in Melbourne too.
We've got,
I'm just getting your thoughts.
we've got a contract, and the contract's not ending next week. Like, we've got years to run, and we're very confident that this is the place for Formula One. This is the home of Formula One, and and many other major events. Is the point that I'm trying to make. Maybe I'm not being as clear as I could be. This is the centre of major events, and so much more. And today, it's the centre of people getting vaccinated really fast, and that's why we're open.
What's the cost to ensure that we can hold on to the F1? Do you think that a bidding war could push up the asking price?
You'd need to speak to the New South Wales government about what their intentions are. Look, I had a very good conversation with Dom last night. He didn't mention the Formula One Grand Prix. So, I don't know, you can read into that whatever you want. It'll be here in April. If the New South Wales Premier wants an invite, I'm more than happy to arrange one for him.
Could I ask Brett a question?
Before we do that,
Yeah.
Absolutely, you can. Rich, sorry, yes, Rich. It'll be as full as it can safely be. I'm not going to commit to it. I'm not going to commit to it being 100,000. There are things to go through. There are protocols to go through, but I want the place as full as possible, and I can't guarantee that outcome, but that's the outcome I'm working towards. Yes, yes.
Given fewer people will be coming into hotel quarantine and it's not going to be for non-Australians, it's Australians returning.
Yep.
How long do you foresee Mickleham, after it's up and running, being part of our, program for people coming into the country?
Well, I'd refer you, and I'm not here for an argument with the Commonwealth, and I don't want to be characterised that way, but I answered the question the other day by saying that we didn't have Mickleham at the beginning of this pandemic. We will have it at the beginning of the next one, and I think that's a really important thing. We'll have it for bushfire, for flood, for all sorts of purposes, and we will have people who are not vaccinated, and it's much safer to have them there than have them in a hotel. And by the way, as Nick points out, we're going to get tourists back here. They're going to want the hotel beds, not people who are in quarantine. So our purpose-built facility works for all those reasons. And then the other thing too, and whilst there's been some promising approvals in relation to Sinopharma and some of the vaccines in some parts of the world, there's bound to be, in fact there are, a range of vaccines that are not on the approved list. So if those people want to come here, even though they've had their 2 shots, we may not recognise that. So I think it's going to have utility. It's also modular. It's not, like, it can be 2, 3, 4, 5,000 people. I don't think it's going to get that big. I think its first stage is about 500, and I reckon we'll make very good use of those. Whether it grows over time, that'll be a function of all sorts of different issues, variants and all sorts of issues.
Tourism authorities here in Victoria are concerned about what Qantas did today. I know you said you've been talking with Qantas, but
Yep.
Can you guarantee them Melbourne has not been at a disadvantage because New South Wales had a head start?
Well, I didn't give New South Wales the head start. The Commonwealth Government did by giving them the vaccines they gave them. But in any event, we're almost there. We're within a week, right? We're within a week. And that's a testament to every single Victorian. And today's a very positive day, so I don't want to get into an argument that's not really worth having, with the feds, I mean. In terms of Melbourne Airport, it's a curfew-free airport. It's the only one of its nature anywhere in our country. So the notion that we're at a disadvantage when it comes to large numbers of flights arriving here at all hours of the day, that just doesn't stack up. We have an alignment between what's going to happen there and what's happening here. And I think you'll see, if our discussions with Qantas are anything to go by, I reckon before your bulletin tonight, there might well be some positive announcements. I certainly hope so. That's what we've been working towards.
Have any decisions been made on Derby Day, crowds at Derby Day?
Active consideration still. We'll have some more to say about that soon. I want to see crowds there, and the challenge, or not a challenge, but the issue for us is that because we've moved through these gateways so fast and we've kind of compressed all the timelines, we don't really have time in Melbourne to run the trials that we've been running in regional Victoria. So some larger events that are not hundreds but thousands of people, they serve a really important purpose. And others who follow these things better than me, they tell me it's the best day's racing anywhere in the country, any day of the year. So it'd be great if there was a crowd there to see it.
If we are going to hit that 80% before Derby Day, how much of a head start do you think that they need to get ready for crowds?
Yeah, look, I don't want to de facto make the announcement because the decision hasn't been made, but we're working very closely with them on that. Of course, there's 3 other events happening that week: Cup Day, Oaks Day and Stakes Day. So we're in constant discussions with them. And can I say to the VRC, they've done, and Flemington, they've done a fantastic job, absolutely fantastic job in being ready. But hopefully we can have some more positive things to say about the rest of the Melbourne Cup Carnival. Anything else for me?
Yeah, I've got one, sorry.
Sure.
CEO of Swan Hill Council has announced he's not going to get vaccinated and instead work from home. Is that a good message to send to the community?
I don't believe I've met the CEO of the Swan Hill Council. I would ask that person, he or she, I'd simply say, if you don't want to finish up in hospital, please go and get vaccinated. And with the greatest of respect, and again, I haven't seen the comments, I'll take your word for it, Rich, you'll be working from home for a while because we haven't set up a vaccinated economy just to dismantle it 5 minutes after we get the thing going. Like, that's not happening here for the best of reasons, because I've got health advice and just logic and common sense tells you that a vaccinated person is at but a fraction of the risk of putting avoidable pressure on our nurses and our hospital system. So why would you not give preference to people who've done the right thing? They've done what we asked them to do. Go and get vaccinated. And now we're going to provide as much freedom and as many options to them as we possibly can. I would respectfully say to that person, please go and get vaccinated. It's safe, it's free, it works, and it is available in record terms.
How long do you envisage CQV having to operate for? 6 months or 12 months?
Well, they're going to run Mickleham, so they'll have carriage of that. So there'll be a CQV. But just like all of our pandemic response, it'll surge when it needs to and it'll be less when it doesn't. But the other thing too is there's lots of other roles. So we may redeploy some people. There'll be a process to go through there. But as I said to in my very good discussion with Dominic last evening, they're going down to a couple of hotels. We'll go down to probably a similar sort of number, and then we'll move our operations out to Mickleham. So there'll be a CQV role, but it won't be as big as it's been because we won't have the number of people that we have to care for.
I can't believe I'm asking this, but is it time to get on
And yet you are still going to.
Is it time to get on the deal?
Yeah, I think it is. Yeah, it is. Provided you go and get your second dose, or bring forward your second dose if you possibly can, because that's when we get to 80 faster, and that's when we have many more options.
Have you got a game of golf booked at Sandhurst?
Not at Sandhurst, no, but I do have a game of golf booked. I do.
This weekend?
Yes. It'll be the first game of golf I've had. I didn't want to play while lockdown was on because I had other things to focus on, getting out of lockdown, namely. But I'll have my first game of golf in about 7 months tomorrow, so 4. It'll be sideways, but it'll be fun. It's a walk. It's a walk, if nothing else. Now you had a long interrogation of the Chief Health Officer you wanted to get to, yeah? Thank you.
Brett, way the information in the daily update provided looked a bit different today. I think all the same information is there, but it's in a different order. Can you walk us through those changes and why they're made?
Look, I think it's appropriate that we focus on the levels of vaccination we're getting to for all the reasons that we've talked about today. So high vaccination coverage is literally representative of the protections of everyone across the state and of our health system, and it's the target we really need to focus on. And it might not seem like a lot, but getting to 90% means something. Getting to 95%, it's actually reducing by half the number of vulnerable people who might end up dying in ICU and hospitalised. It's a really significant thing to go above and beyond that 90% mark as well. So I think it's appropriate to focus on that vaccination rate that we're getting through and the coverage that we're heading towards. We are not in the same situation as New South Wales. They've reached it a little bit earlier. We are also on the top of our curve as we ease some restrictions. So, our roadmap is appropriately adjusted to the epidemiology in Victoria. We've got school going back, but we've got 20,000 plus active cases. So we have to bear that in mind as we step carefully through everything. We have to be aware of the number of active cases that we've got, and the vaccination coverage is that other kind of counterpoint to that.
And with more venues open, there's the potential for more exposure sites as people move around. Are you anticipating over the next few weeks for there to be many more Victorians in isolation as close contacts?
Look, there's potential for it, but at the same time we're recognising that when we've got a vaccinated economy, we've got vaccinated requirements for those settings, we're not going to get the same kind of number of close contacts, and they won't be quarantining for as long a period, so that cumulative number of people who are close contacts won't have the same pressures at all.
What's the expectation on kids over 12 showing their, between 12 and 16, showing their double vax kind of status when, if, say, they go to the hairdresser with their parent or going to the zoo, that sort of thing?
Yeah, look, the same requirement for everyone else who's in an eligible age group to show their vaccination certificate. They are as vulnerable, if you like, to COVID infection as anyone else who's unvaccinated, and they've got similar protections being fully vaccinated. So it's an important thing to check.
So previously it was that only those over 16, because that's obviously within the 70% that we're counting at the moment, would have to show that proof. Is that now being extended down to anyone 12 and above?
My understanding is yes. I didn't sign the directions on the relevant mandatory vaccination threshold days, but that's my understanding.
You clarified some information on Twitter this week around the need for deep cleans, and that they shouldn't necessarily be deep cleans, they should be surface cleans now. I wondered if you could clarify that, and there has been a rebate for businesses to get those deep cleans. Is something like that still necessary?
So they're not going to look the same. We know from, again, international literature and a deeper understanding of what surface contamination can do, that it's really not as significant a risk as the shared air as being in the same, especially indoor space, and that the cleans that need to occur are really the high-touch surfaces, so the door handles, the railings, the things that lots of people will touch in those environments. They need to be cleaned down, but it's not a case of cleaning every single surface with a disinfectant in the same way. And it is a burden. It costs money, it uses a lot of chemicals, and it takes a lot of time and effort. So that those requirements have shifted.
Does that mean the need for a rebate for $10,000 isn't necessarily needed?
It shouldn't be the same requirement, no, going forward.
How long do you think we need a vaccinated economy for, and is there a level of vaccine coverage at which you will recommend we don't need that system anymore?
I don't know that it'll be a case of a specific vaccine coverage, but it's clear that the higher and higher we get, the more we'll see normal life return, and those individuals who are vaccinated, who get their booster, they'll have long-term protection. So, that'll be a long-term protection for us as a society. It's also clear that there are, trials underway, and the FDA in the US are looking at vaccines for 5 to 11-year-olds. They will make the same applications to the TGA here. That'll make a difference to what we can do and how we see transmission change. So we'll keep an eye on that, and that'll make a big difference. But you can't make a call just on 12 and above vaccination coverage at this point in time. We don't know how transmission will go under that scenario. We know the higher we get, the more downward pressure there'll be on transmission. But there are ongoing challenges in countries with very high vaccination coverage, so we want to encourage that to the fullest extent possible. Thank you.
Thank you.
That's the answer. But it's been,
That was all Jimmy, wasn't it?
they might